Hi there, this is Dr. Arif Khan, and today I'm going to talk to you about myths in epilepsy. So let's start off. Myth number one is this: you cannot swallow your tongue. It's physically impossible to swallow your tongue. Yes, sometimes aspiration of liquid or food can happen, and this is something you need to watch out for. Myth number two: absolutely not. Actually, that's a good way to chip someone's teeth off, or puncture their gums, or even break their jaw. The correct first aid is simple. Just gently roll the person on one side and put something soft under their or his or her head to protect him or her from getting injured. Now, myth number three: never ever use restraint. The seizure will run its course and you cannot stop it. However, if you have some rescue medication which has been prescribed to you, then you use it. Myth number four: epilepsy is about as contagious as a gunshot wound. You simply can't catch epilepsy from another person. Myth number five: epilepsy happens to people of any age. Even older people from 65 years of age and above can have epilepsy. Myth number six: people with epilepsy have the same range of abilities and intelligence as the rest of us. Some have severe seizures and cannot work. Others are successful and productive in challenging careers. Myth number seven: a job of responsibility and stress. People with seizure disorder are found in all walks of life and at all levels, in businesses, in government jobs, arts, and professions. We aren't always aware of them because many people, even today, do not talk about having epilepsy just for the fear of what others might think. And that's where we say there's a lot of stigma attached to this condition. Myth number eight: epilepsy is a chronic medical problem that for many people can be successfully treated. Unfortunately, treatment doesn't work for everyone, and there is a critical need for more research in this particular area. Now, moving on to myth number nine. No, epilepsy is not rare. It happens in about one in 100 children. That's if you have a school of 3,000 children, about 30 of them will have epilepsy, and that's not rare. And epilepsy itself, the number of people having epilepsy is more than double than people with cerebral palsy, muscular dystrophy, cystic fibrosis, multiple sclerosis put together. Now, we know that epilepsy can occur as a single condition or may accompany other conditions affecting the brain, such as cerebral palsy or intellectual impairment, autism, Alzheimer's, and even traumatic brain injury. Myth number 10. That's not true. Epilepsy still can be a very serious condition, and individuals do die of it. Now, there's a lot of research on this, and experts estimate that prolonged seizures, also called as status epilepticus, are the cause of many deaths in many countries each year. Myth number 11. Now, that's completely not true. Seizures commonly take a characteristic form, and the individual will do much the same thing during each seizure that he or she has. Now, at that point when the seizure is happening, his behavior may be inappropriate for the time and place, but it's unlikely to cause harm to anyone around him or her. So when you're going to help someone with epilepsy or seizures, don't worry that it's going to affect you in any way. Now, myth number 12. In most cases, epilepsy isn't a barrier to physical achievement. Although some individuals who are more severely affected with epilepsy and may be limited in what they can do are present, but that is rare. More commonly, when epilepsy affects a person, it doesn't take away any ability from them as such, and they can lead a completely normal life, just like you and me. If you need any further information on this, speak to your neurologist or your pediatrician. Stay safe and look after people around you. Bye-bye.